FRONTLINE's an artist-led company. We place disabled people and those with long-term health conditions at the core of the organisation as participants, dancers, leaders, producers, all everywhere really. Today is part of our tour to hospitals, so we're going around the renal unit and the cancer centre here at Royal Stoke Hospital, and we're performing and doing participatory exercises with the patients. When we're in hospital, patients have told us that it helps pass the time away, that it takes their mind off what they're here for. It's completely non-clinical and non-medical, so it's a nice surprise for them to suddenly have performances from musicians and dancers that's come into a space where it can be quite uncomfortable, and often people are dealing with things for the first time. So, you know, a new body, a different health condition. Others have been doing this for years and years and years, so it helps to pass the time away and give them something to think about, to talk about, and yeah, conversation starter as well.
Is the holistic, innovative approach that brings one from the dark to the light immediately and brings so much smiles and so much happiness that you start to feel better. Even if you're experiencing the side effect, you feel better. The grade 3 lethargy, what we call it as grade 3, the worst, becomes grade 1 or even grade 0. They started to walk, they feel better, and that's the magic. That's the empowerment that you can, you give an impact to the patients or the staff like me who was watching, or the employees or the passerby in the treatment environment. That engagement, that positive energy. I saw that at the frontline dancers, and I'm I'm overwhelmed. I have no words to express how good, and this is the best performance I've ever seen. And I wish them all the very best, and I want this to spread, globally, because this fire needs carrying out and reaching out elsewhere.
I think it's really nice. Anybody that's undergoing some therapy or as an inpatient having treatment can be quite a difficult time for a patient, so something that will ease that and bring some level of happiness and distraction, I think is a benefit, yeah, absolutely.
I think that arts, and especially frontline dance, have a really important role to play. So everybody knows about visual arts and how that can give you something to look at while you're here waiting, or you might be reading a book when you're a patient here. But I think there's something beautiful about music and connection with human beings, which sometimes dance can bring into the space. Art should be part of every day. It is part of every day, from the TV that you watch to the, for how the places look. Why wouldn't arts happen in a hospital? And how do we encourage people to expect more, arts on the walls, but also artistic experiences as part of their care?